Hi everyone, can you guys hear me? Give me a thumbs up if you can hear me. Awesome. Gonna wait a few more minutes to let other people hop on. In the meantime, why don't you drop where you are watching from? I am in North Jersey, so I'm curious to see where everyone else is listening from. Got another North Jersey. The Poconos. Hey, Jenna. Outside of Chicago. Pennsylvania. That's where I'm originally from. All right, so I'm going to get started here. For those of you who may not have seen any of the other stories or posts on Pelvic Rehab's Instagram, I am Jen Navon, and I am a nutrition and health coach. I will be teaching nutrition courses for pelvic rehabilitation. So if you're interested, stay tuned because we are launching those to help educate on nutrition and endometriosis. And then we'll have other courses coming out later in the year. So I'm going to start with the first question that I got. Recommendations on what to do the days leading up to your period to lessen pain and inflammation. So from a nutrition and supplement standpoint, I really love magnesium. Magnesium is used in over 300 processes in the body, and most of us are deficient in it, just because we don't get it through our food and the soil isn't as rich as it used to be. And it plays a crucial role in reducing inflammation, and it can really help to relax muscles, cramping, and pain. So eating magnesium-rich foods like cacao, avocados, dark leafy greens, but also supplementing with it. I really like magnesium glycinate and citrate. They are the most easily absorbed in the body. And really dosing depends on the person. I find that like 400 milligrams to 600 can be a sweet spot, but you also want to be careful not to overload magnesium because it can cause loose stool. Some other herbs or spices I really like to use to help reduce pain and inflammation are turmeric, ginger, and cinnamon. Making ginger bombs is really awesome leading up to your period to help reduce some of that pain and inflammation. But you can also get capsules of turmeric, ginger, and cinnamon to get a higher dose. But I mean, I just love putting them on food anyway. I put cinnamon on like everything, and that really helps. And then outside of nutrition, I do love castor oil packs. I find that those can really help reduce inflammation, especially if you put it over your pelvic area in the front, like over your belly button and your lower abdomen. And light movement. This is pretty big leading up to your period because you're in the luteal phase of your cycle, and during the luteal phase, your progesterone is highest. We don't want to be pushing any type of HIIT training or super intense lifting or just super intense like cycling or running, because that can cause your body to stress out and decrease progesterone levels. And progesterone is the counterbalance to estrogen, and that progesterone can have a calming effect, a muscle relaxing effect on the body. So focusing on light movement, like light yoga, gentle walking, I would say like those are pretty the biggest things. Bar classes are pretty low intensity, Pilates. And then I know that there's some really great yoga for endo or pelvic pain on YouTube. So you could always check that out too. And then another thing leading up to your period as well, I love the supplement Menstrually by New Ethics. It is a great blend of different herbs and vitamins and minerals that help with all PMS symptoms like moodiness, cramping, pain. It has been a game changer for a bunch of my clients. So I highly recommend that supplement. All right, next question. Is there a connection between gut health and endometriosis? Absolutely. There are so many women that I see and I hear from that come in with SIBO or IBS and endometriosis. So there is a very, very close connection here. Now, because endometriosis has been linked to the immune system, it's important to know that 70 to 80% of the immune system is in the gut. So if you're having any GI symptoms that are out of the ordinary, like constipation, diarrhea, abdominal pain, extreme bloating or distension, excess amount of gas, acid reflux, that feeling that food is sitting in your stomach, but also some symptoms outside of just GI, skin issues like eczema and acne, and even like brain fog can be a sign of gut dysbiosis. You really want to look into what's happening in the GI tract. If there's an overgrowth of bad bacteria or an undergrowth of good bacteria or just some sort of imbalance, that can cause major inflammation and affect your gut immune system. And we have to remember that the GI tract is so close to the uterus and all our other lady parts because everything's like really in the pelvic cavity. So if your gut is inflamed, that inflammation doesn't necessarily always stay local. It can go systemic. So if you're coming in with GI symptoms, I would definitely recommend working with somebody to help get to the root cause of those GI symptoms, whether it's finding out what type of overgrowth you have or undergrowth, and then really working through a gut protocol to help rebalance everything. It can be really tough if you don't address one of those root causes to the endometriosis. And if you have lingering gut pain or GI symptoms, that can contribute to making your endometriosis either continue to grow or make your pain a little bit worse. Question number 3, what is the best diet for endometriosis? I get asked all the time, what is the best diet in general? And I'm going to answer the same way I would for endometriosis, or the other way around. The best diet is the diet that works for you. Now, again, we know endo is inflammatory, so there are specific foods that as a woman with endometriosis, we should be avoiding, like highly processed foods, oils that are high in omega-6 fatty acids like canola oil, safflower oil, vegetable oil, corn oil, avoiding sugar because sugar can be highly inflammatory. But what comes up a lot is Should I be gluten-free? Should I be dairy-free? Should I be soy-free? Well, that really depends on the person. What I would recommend doing is, if you're not sure if you have a trigger food or if you're not sure if something is causing inflammation, do an elimination diet. I find that with my clients, putting them on an elimination diet for about 4 weeks and then slowly reintroducing the foods one at a time can really help us pinpoint what is causing inflammation or what can make pain worse. Now, the cool thing about endometriosis is that your pain can be cyclical. So your pain might only occur at ovulation and your period, or it might only occur at your period. So when you're doing an elimination diet, I would recommend waiting a full cycle and seeing how your symptoms improve or don't improve, and then slowly bring those foods back in. So if you eliminated gluten, bring a small amount of gluten back in and see how your body does over your next cycle. And if you feel like it's a safe food, your symptoms are still manageable, no GI symptoms, anything like that, you can consider it safe. But if you're looking at like an overall diet, I think that the Mediterranean diet is a really good base diet. It's moderate amount of protein, higher in carbs, and a moderate amount of fat. And it really focuses on good quality protein, so being organic or grass-fed, lots of organic fruits and vegetables, legumes, whole grains, nuts and seeds, and healthy fats that are rich in omega-3 fatty acids like grass-fed ghee or butter, olive oil, avocados. Those are all great fat sources. So if you're going to want to try out a diet to be anti-inflammatory, I would definitely go the route of Mediterranean. Do an elimination diet to figure out your food triggers. For me personally, I stay away from gluten and corn because my body really reacts to those, but I know that's not always the case for other women. So you got to figure out what works best for you. What are some daily things I can do to reduce my endo pain and bloat? So first, reduce inflammation. And there's a bunch of different ways we can reduce inflammation by removing food triggers like I just talked about, managing stress, and paying attention to exercise. If you're finding that you're hitting the gym a little bit too hard, your exercise is too intense, it could be causing more inflammation throughout your body. Something else that can sometimes go overlooked is the quality of your products. And by products, I mean beauty and skincare, household cleaning products, even clothes can have coatings of chemicals on them that can be causing inflammation. And while it's for most people, you kind of have to like go slowly when it comes to changing your household and skincare products. I don't recommend just throwing everything away and buying everything new because it can be really stressful and overwhelming. So as you start to run out of products, you can replace them with cleaner brands. And a good place to check out the clean brands and products is the EWG website. You can search a brand, like if you wanted to search Degree deodorant, you type in Degree and it'll tell you the toxicity level of the product. So that's definitely something you can do to reduce inflammation. Another thing that you can do on a daily basis to help reduce endo pain is balance your hormones. And this, again, can be done throughout your whole cycle. Endometriosis is linked to high estrogen, and ensuring that your estrogen, progesterone, and testosterone are all in balance at specific times of your cycle can make a really big difference in how your body feels, especially come the time that you're ovulating or at your period. I started by changing hair care products. Simple start. Yeah, absolutely. I think I started with face wash. So whatever I was putting on my face is the first thing I changed out. And then my body, trying to get rid of things with fragrances. And then I went hair care, which can be a little hard because I have curly hair. It's really hard to find clean curly hair products. And deodorant, that's a big one too. So yeah, starting small and simple is definitely the right move. Okay, I also got asked, what are my favorite snacks? So my first rule is never eat a naked carb. And that's because carbs can cause a spike in blood sugar, and a spike in blood sugar can cause inflammation. So one thing that you do want to focus on when you're picking meals or snacks specifically is pairing any carb with a protein and a fat. And another thing that I do when I pick out snacks is try to make them as colorful as possible. I am a sucker for colors. I try to get all different types of colors in all my meals. Like I'm chasing purple vegetables, blue fruits, like not just the greens, even you adding in the whites, the reds, oranges, it's all super beneficial. So I can kind of tell you guys what my favorite combinations are for snacks. I really love berries. Raspberries and blackberries have been my favorite like all winter long. And I love pairing them with a type of nut. So almonds or macadamia nuts. I really love macadamia nuts. Another snack that I really like is oatmeal with nut butter. If you're going to get oatmeal, make sure you get organic because oats are a lot of times spread with pesticides. So organic oats and any kind of nut butter. I love peanut butter. So that's a good combination. That fat will help balance out any blood sugar spikes. And oatmeal is high in fiber. Cucumbers, carrots with guac. Love veggies. I really love rainbow carrots. The purple ones are super good. And then guac made out of avocados. You got a source of healthy fat there, and you're also getting a lot of fiber. Full fat Greek yogurt with seeds and berries. We want to go full fat. Trying to get grass-fed yogurt or dairy products is very, very important because a lot of times cows are given antibiotics and steroids. What your food eats or what the animal eats is what you eat. So we want to try and avoid any of those antibiotics and steroids. And then full fat, of course, because it's less processed. You're not stripping everything out of the yogurt itself. And different types of seeds. I love chia seeds and flax seeds. I am also pretty big into seed cycling with the cycle. Pumpkin seeds and flax seeds are really good during the follicular phase to help support estrogen and detoxification. And sunflower seeds and sesame seeds are really good during the luteal phase to support progesterone levels. So just a little bit of food for thought. If you're interested in seed cycling, there's some really great resources out there. And the last snack that I have on my list over here is hard-boiled eggs with sauerkraut. Now, I don't put the sauerkraut on the hard-boiled eggs. I eat them separate. I can just kind of eat spoonfuls of sauerkraut, but sauerkraut it's high in probiotics because it's fermented, so that's going to be good for the gut. And it's also made up of cabbage, which is a cruciferous veggie, and cruciferous veggies can help bind to excess estrogen and help support liver health, so it can help with detoxification. Becky asked, I've had a hysterectomy but still have my ovaries, so I can't work out my cycle. How would I work around that? So Becky, I actually love this question. I do have some clients in the same situation where they have their ovaries but no uterus. So they're, technically not cycling. But what's interesting is, depending on your age, you could still be ovulating. So even if you're not getting a bleed, you may be able to track ovulation because your body is still on a clock, essentially. So what you can do to see if you're ovulating is track your basal body temperature. Your basal body temperature you can take upon waking. So before you get out of bed, check your temperature and track it in an app or on some type of graph. I really like the Natural Cycles app. It syncs to an Oura ring, which also takes your temperature. And then there's also, I believe it's fertilityfriend.com, where you can chart your temperatures. But what happens is when you ovulate, you get a spike in basal body temperature. So when you ovulate, your temperature will increase and it'll stay increased until, if you're cycling, until you get your period. But you're saying you're in perimenopause. So your hormones are most likely kind of just like all over the place. Estrogen, progesterone are up and down, but you still could be ovulating. So it would be helpful to just try tracking your temperature for a few months and see if you notice any patterns. And if that's the case, you kind of have like an invisible luteal phase and an invisible follicular phase, and you can work out around your cycle then because your ovaries are still producing hormones. Britt Marie says, I like mixing in sauerkraut and soft scrambled eggs. Very yummy. Yeah, I do put sauerkraut on top of eggs. I like to do fried eggs. I'll put some salsa on, some guac, and then top it with sauerkraut. It's a great breakfast. You're welcome, Becky. And yes, sauerkraut is so good for you. Sauerkraut and kimchi are great fermented veggies, and kimchi I believe has the is it chili pepper? It has something spicy in it, and I don't do spicy, so I don't always do kimchi. But there are some really great sauerkrauts. If anybody has Whole Foods near them, especially for my people in the Northeast, there is a really great brand called Hawthorne Valley. They have sauerkraut with carrot and ginger in it. And I love ginger, and we know ginger is anti-inflammatory. I love it. It's so good. I was also asked favorite supplements for endo. Okay, so one I mentioned before is Menstrual Ease. Jenna can attest to that. She said it's a game changer. Second, I really like SPM Active by Metagenics. SPM Active is a fatty acid supplement, and specifically it can help reduce inflammation and support immune dysfunction. So I really like that. I actually used that after my excision surgery, and it really helped reduce my inflammation once I was able to start taking supplements again and once I was in that healing phase. I also really liked Chasteberry or Vitex. Chasteberry does a really great job of balancing progesterone and estrogen. Now, before anybody goes taking any Chasteberry or supplements like that, I do recommend getting your hormone levels checked by your doctor or practitioner just to make sure that you're not going to be pushing too much progesterone if your progesterone is already high. Another supplement that I like is Hormone Plus Complete, and this is also by New Ethics. It does a really good job if you are somebody who is estrogen dominant to help flush out excess estrogen and support the liver in the detoxification process. So I would say those are my 4 top supplements for endo. What other fermented foods or drinks do you recommend? Yeah, so kefir is great if you can do dairy. That is it's a cultured probiotic drink. Greek yogurt, like I mentioned before, full fat, grass fed, if possible. Sauerkraut, kimchi. I would say those are probably my top probiotic rich foods. I just had another one come to mind. Oh, kombucha is probiotic, but you want to watch the sugars in that. A lot of times kombucha is super high in sugar, and you don't want to be drinking that alone because, like I mentioned before, it can spike your blood sugar and can cause more harm than good. Jenna, what about Estrocort? Yes, Estrocort is awesome, but again, before I would recommend Estrocort, I would say get your hormones checked because Estrocort is meant to help detox estrogen. And if you're somebody who is lower estrogen, you don't want to throw in Estrocort and then be detoxing it because then you won't really have any left. So that's important to keep in mind too. But that is a great product if you know you have high estrogen or if you know you're detoxing it down the 4-OH or 16-OH pathway. Does a poor diet contribute to endo growth or just trigger inflammation? So when we're looking at diet, well, let me back up. If we're looking at endometriosis, there are a few potential root causes. It could be retrograde menstruation, immune dysfunction, environmental toxins, estrogen dominance, gut inflammation. There's a bunch of different things that could cause endometriosis. And while there are several potential causes, a poor diet can definitely contribute to inflammation in the body, and that inflammation can encourage the growth of lesions. So while, me sitting here saying like, if you drank a quarter of a cup of canola oil, like, is that oil going to give you endo directly? Not, probably not. But it can contribute to the inflammation in your body that may be causing the lesions. So there is a connection when there is a poor diet filled with foods that either your body finds inflammatory or that are just have inflammatory properties in general, that can cause GI distress and inflammation. If there's GI distress and inflammation, that can cause leaky gut or intestinal impermeability. This is where the lining of the intestines, they should be tight junctions, it becomes compromised and kind of starts to grow apart. And then these food particles get in between the junctions in the gut, causing inflammation, causing your immune system to react because now there's your body's reacting to these foods in your bloodstream. And if you have leaky gut, this can cause estrogen dominance because estrogen can be detoxed through the GI system through bowel movements. And if you are dealing with estrogen dominance and your estrogen is being recirculated into your body, into your bloodstream, that can cause the growth of lesions. So there's this cycle. So making food choices that are the best for you and shopping the perimeter of the grocery store, buying organic when you can, and following a Mediterranean diet the best you can could definitely help reduce some of that inflammation. Britt Marie asks, can you live with endo and manage it through functional nutrition without ever having excision surgery? Do you only need surgery if you have pain? Oh, that's a really good question. So I'm going to say it depends. It really depends on the person. So for me personally, in my story with endo, I didn't have painful periods, but I had it in just the right spots that it was causing me digestive issues. So even though I was eating the best I could, managing my stress, getting my inflammation down, going to pelvic floor therapy, I was actually a patient at Pelvic Rehab Medicine. I got the muscular injections to help relax the muscles. Things still weren't working. So for me, excision surgery was kind of like my last choice to help remove my endo so I could continue living a healthy, happy life. But you can definitely reduce pain, reduce inflammation, and live happy and healthy with endo without having surgery. But again, it really depends on the person. Some women are in so much pain, maybe dealing with infertility, and the surgery might be the best option for them. All right. Overall, what are your biggest nutrition tips? So I do have a handful of nutrition tips that I follow myself and I like to really encourage my clients to follow. First is low glycemic index foods, because if we are going high glycemic index or high glycemic load, that could be causing spikes in blood sugar or blood sugar dysregulation. And a balanced blood sugar is really important in keeping inflammation down. Focusing on frequency and timing is also important when it comes to nutrition, because there's a few reasons why, but from a digestive standpoint, we want to be leaving about at least 2 hours in between meals. That way your body has enough time to push food out of your stomach into your small intestine, and then your small intestine into your colon. And if you're somebody who's constantly grazing or snacking, your migrating motor complex, which pushes food through your digestive tract, stops. And if that MMC stops, then food may be sitting in places like your small intestine or your colon, and that can leave you at risk for a bacterial overgrowth. So paying attention to how often you're eating is going to play a big role in how your digestive system works and how your body feels. And then along with timing, eating, this may sound a little funny, but eating with the sun and trying to dial into your circadian rhythm can make a difference too. If you're eating when you wake up in the morning and the sun is up, your body's awake, it's ready to digest. If your last meal is around when the sun goes down, your body knows that it's time to wind down. So leaving that time from sun up to sun down to eat and trying to avoid eating outside of that can make a big difference. If you're eating too close to bed, your body doesn't want to digest food when it's sleeping. It wants to sleep, recover, repair, and reset. So avoiding food within 2 hours of bed is also a really good tip. Or if you do need to eat closer to bed, make sure it's a smaller meal so that you're not going to bed too full. Balanced, whole, and fresh. So I like to see a veggie, a carb, a protein, and a fat on your plate at every meal or every snack. Well, maybe not every snack, but every main meal. We want a balance. We want a colorful, whole, fresh plate of food when possible. Being mindful and relaxed during meals is also going to play a big role in your body's ability to digest foods and its inflammatory response to foods. If you're somebody who's always eating on the go, you're driving while you're eating, working while you're eating, you're not necessarily in a parasympathetic state. Parasympathetic is our rest and digest state. Sympathetic is our fight or flight. So imagine being chased by a bear. You're probably not going to digest the burrito you're eating very well if you're like super wired and stressed out at the time that you're eating, right? So really relaxing, making sure both feet are on the ground, breathing, enjoying the colors on your plate, the smells of your food, the people that you're with, chewing your food 20 to 30 times. Yes, I know it's weird to count how many times you chew, but it can help. Can make digestion and your body's ability to absorb food and nutrients so much better. Okay, so that's all I have for the questions that were submitted prior to the live. Does anyone have any other questions that they would like me to answer? If you do, you can go ahead and drop them. It can be a new question, the question based off of something I already mentioned or talked about. It can be anything nutrition, doesn't necessarily have to be endo, or it could be nutrition and pelvic pain, anything like that. We'll give it another second. I know sometimes the messages coming in are delayed. Okay, well, if there aren't any other questions, I'm going to leave you guys with a few things. So first, okay, here they come. Oh, that was like super delayed. There we go. Okay, Jenna, how would I know when it's time to seek out pelvic floor rehab providers? Ooh, I like that question. So I would say if you're having pelvic pain. So that pelvic pain could be while you're lifting weights, during intercourse, even just sitting or standing for too long. If you're dealing with like severe pelvic pain around ovulation or your period, that can definitely be a good indicator that it's time to find a pelvic floor therapist. Now, with pelvic floor therapy, I think a lot of times there's a misconception that pelvic floor therapy is only for, after you have babies or after you give birth, or if you're maybe having some urinary incontinence, but it can be for pain. And it doesn't mean that pelvic floor therapy isn't just doing Kegels. There's a lot of other things that they can teach you, like how to breathe, how to relax your muscles, how to contract your muscles and control your muscles properly. So you can learn a lot at pelvic floor therapy. And I mean, anybody who has endometriosis that I speak with, I always recommend finding a good pelvic floor therapist because you can really benefit from it, no matter, I guess, where that level of pain is. Brittany is asking, how did you find a doctor to do endo-excision rather than cauterizing the lesions? Yes, so that was something. So for a little bit of my history again, I went to pelvic floor therapy, and luckily my pelvic floor therapist was very knowledgeable in endometriosis, before I even knew I had it. And we had the conversation of, cutting out the endo versus burning off the endo, where cutting out the endometriosis, you're essentially removing the whole lesion, where doing an ablation surgery or burning it off doesn't mean that you're getting rid of the whole lesion. So that's something that you would have to, I guess, when you're looking for doctors, that's a question that I would definitely ask. And if you're searching for doctors, first of all, Pelvic Rehabilitation Medicine, phenomenal surgeons. Like, we have the best surgeons, and they're so great. Going in for surgery is scary, and you need to be able to trust your doctor. So even if you have to shop around for doctors, don't just stop at one consultation. Continue to ask questions. Nancy's Nook has really great resources. You can find them on Facebook, or you can go on their website. I believe that they have a document of, I think the document is called What to Ask Your Surgeon or What to Ask Your Doctor. So I think that's a good place to start. Would you eat the same things for psoriatic arthritis, with that being an inflammatory disease as well? Yes, Becky, for sure. I think a Mediterranean diet and avoiding processed foods, doing an elimination diet, can be so helpful for psoriatic arthritis or really any type of joint pain. But again, I'm going to say it, I recommend an elimination diet because you could be eating something that's causing more inflammation in your body and you don't even know it. So see if you can eliminate gluten, wheat, soy, corn, dairy, coffee, and alcohol for 4 weeks, and then slowly reintroduce the foods a little bit, one at a time, and see how your body feels. Those are great questions. Any other questions for me? Okay, so while I let you guys think, if you want to drop any other questions in the chat, you can follow me on Instagram at Functional Health Jen. The Endometriosis Summit is at the end of this month. I am going to be there with the rest of the Pelvic Rehabilitation Medicine team. I'm super looking forward to it. So if, you can get tickets if you want to take a trip down to Orlando. I believe it's virtual too. If you can check on the website for the Endometriosis Summit. And also, like I mentioned, at the beginning of April, I am starting a endometriosis and nutrition course with Pelvic Rehab. So if you're interested in learning more, you want to dive a little bit deeper into some of the topics that I talked about, send us a message, DM us, and we can get you the information to sign up for the course. It's going to be 8 weeks, and there's going to be a lot of great information there that can be a game changer if you're struggling with endo. And we're going to end on Jenna's win. She had a pain-free period this month. Not a question, but it for sure is a win. It is possible to live with endo pain-free, when you go to dial in nutrition, inflammation, and address the root causes. All right, so I hope to hear from some of you guys. Send us a message in the DMs. I hope everybody has a great rest of their Tuesday, and shoot me a message if you have any other questions. Thanks for tuning in.